Hello and welcome to the Health Wrap by The Hindu. This is in video format, everything you can learn about health on The Hindu through its various formats. Through Health Wrap, we aim to bring you news, analysis, views and explainers from different parts of the world and point you out to health news you can go back to and read on our website. Do not forget to wait for our expert segment. Today, it will be Dr. Monisha Madhumita, a dermatologist who will give you tips that you can follow this season. Diving right in. Today I have with me Zubaida Hamid, who's also on the health desk. So Zubaida, let's talk about the elephant in the room. For nearly weeks now, people have been asking us about COVID. There's a palpable sense of panic. Is it a pandemic? Do we have to be prepared? Do we have to take precautions? And I think finally the numbers are rising a bit, isn't there?
Yes, the numbers are rising, Ramya. We have now logged over 1,000 active COVID cases in India. There have been several deaths as well. But experts have repeatedly told us that this is not another pandemic situation as of now. The cases have remained mild for the most part without requiring hospitalization. And we need to do what we were doing back in 2020 and 2021, which is masking up, taking precautions such as hand washing and avoiding overcrowded places, and of course protecting the vulnerable segments of our society.
Yeah, and the other thing that we have to make sure that there are adequate supplies of is vaccines and boosters. Vaccines for the people who've not been protected so far and boosters for those who've got, vaccines earlier. And it's quite shocking in context that the, US government has decided to not give boosters to young children and pregnant women. I mean, this seems like a harebrained scheme already.
Absolutely, experts are already questioning this move because in general, children and pregnant women are considered amongst the vulnerable sections of population because obviously they have slightly weakened immune systems compared to the rest of the healthy adults. And but we know, of course, that RFK Jr., the health secretary, is a vaccine skeptic, so maybe that says more about it than anything else.
Yeah, but the health of a nation is important, isn't it? Shouldn't be subject to the whims and fancies of one or a
Yes,
group
as
of
the
people.
WHO
Yeah.
constantly points out, health of one person and one country means the health for everybody.
Yeah, absolutely. So unless everyone is safe, no one is actually safe.
Yes. And speaking of the COVID-19 pandemic, the WHO has now called upon nations to go ahead with this pandemic draft treaty agreement that the nations have agreed upon. And what do you think about that, Ramya?
Yeah, I think it is a very significant move that the member nations have agreed to share information, genomic samples, and also to ensure that there is vaccine equity and diagnostics equity as well. So this means that, like we just said, it ensures that everyone is safe at some point of time, and that lack of access to vaccines and to diagnostics because someone is not able to afford them will not happen in a future pandemic. So this is absolutely significant.
Let's hope that the WHO, even with its funding cuts, can go ahead with this. Month, we also saw the second Lancet Commission report on adolescent health, a very important report that has come out that talks about the health of a large section of the world's population, which is young people, the adolescents. Tell us about that, Ramya.
Yeah, so the adolescents today comprise a bulwark that has never before existed and will possibly never exist in the future. And as such, we have made a lot of gains, as the Lancet report shows us, but it is so important to invest wisely in schemes and security for the adolescents who will be tomorrow's future. So if we need to secure our future, we need to invest today and wisely so.
Yes, and speaking of adolescent health, in India we had a little bit of news on that front. The CBSE has mandated that all of its affiliated schools set up sugar boards, trying to give nutritional literacy to young people to show them what your common snacks, how much sugar there is in your common snacks, and why you should not eat them versus eating healthier options. Because we are staring at an obesity crisis, aren't we?
Absolutely, and this is significant, because children seem to listen to schools, teachers, and principals more than they do parents. I can say that from experience. So,
Absolutely.
as long as I'm sure you can as well. So, as long as the teachers say something, the kids are willing to listen, and therefore, cutting down sugar from an early age is very important. And if it is done through the school, then I think it's a lesson for life.
Yes, absolutely, Ramya. And of course, we know that the obesity crisis is only growing in India. They say that by 2030, one in every 10 children globally who are obese will be from India. So this is absolutely an urgent move. Moving on to our next segment. This month also marked Women's Health Awareness Month. Tell us a little bit about menstrual hygiene, something that we have written about extensively on our website.
Yeah, and you know, Zubeda, but this is for our readers. We do a lot of writing on women's health specifically, looking at angles that are perhaps not have not been explored before or require a certain detailing that has not been done before. So, in women's, this particular month, because it's menstrual hygiene month, I think we've brought to the fore with a couple of articles and viewpoints. We've brought to the fore the sense that the sense of shame and stigma that is still attached to menstrual hygiene, and it also prevents hygiene in a certain sense. This also could lead to a large number of dropouts in this country, and we were talking about adolescents, and if you don't take care of girls who are adolescents and their needs, then we are not going to have a very bright future again.
Absolutely. It is so shameful that we're in 2025 and what is a natural biological process is still being stigmatized and taboos are still around it, so preventing open conversations from happening. We were talking a little earlier, Ramya, about RFK Jr. and his vaccine skepticism. One of the things he also said a few weeks ago was that he was going to invest a lot of money into autism research. And while he was saying this, he also said that autism was preventable. That seemed fairly shocking to everybody
Yeah,
who
yeah.
yeah.
There's a fair bit of shocks emanating out of the United States of America, which, whether we like it or not, sits at the fountainhead of scientific and health research in the world. So this is particularly, this has been objected to, and it's particularly shocking that someone of that stature said it. And I don't think, and multiple research has been happening across the world since that, faulty science piece that came out, health research piece that came out on autism. It was later debunked and the articles were withdrawn, but somehow the aura created by that fake news seems to, gain some traction among these skeptics. But I don't think there is any proof today that vaccines cause autism.
Absolutely. The WHO has declared over and over again that it had the MMR vaccine, which was originally linked in that debunked paper, does not cause autism, and there is absolutely no risk in taking any childhood vaccine, and there is no connection with it to autism. And calling it preventable only serves to perhaps place the blame a little bit on parents, especially mothers, giving the impression that had you done this or had you not done that, perhaps your child would not have had ACD. And that's a really risky path to go down, considering this is already a stigmatized section of society.
Absolutely. It doesn't make sense to create new stigma for people or enhance stigma for people with certain, conditions. But, the whole idea is to embrace neurodiverse populations also and see the benefit, not look at it as someone with an illness or a disability.
Yes, absolutely. The other big news this week, Ramya, was that legendary musician Billy Joel cancelled his concert, didn't he? Tell us about what health condition he has.
Yeah, Zubeda, he's one of my favorite musicians, and of course, today I only listen to what my 13-year-old wants to listen to. But Billy Joel did cancel his concerts because he said he was diagnosed with a condition called normal pressure hydrocephalus, and it's a rare but treatable condition, and it can be caused in adults by a buildup of cerebrospinal fluid and in the brain, of course, and which doesn't drain as it is meant to. So these symptoms sometimes mimic Alzheimer's or Parkinson's, but early diagnosis and treatments, particularly using a surgical shunt, can significantly improve the quality of life, and I'm really hoping Billy Joel gets better.
I hope so too. He makes good music.
Yeah, totally. Yeah. So today we have with us Dr. Monisha Madhumita. Dr. Monisha, you've come at a very, very opportune moment because today we have, a climate that's blazing at one point and then there are rains during the night. What is the ideal skincare regimen in these times, you think?
Thanks so much, Ms. Kanan, for having me. Happy to be here. So, when we really talk about the skin, what I admire the most is its resilience, and it shows up in no better time than like this, where it's so hot and blazing during the day, and then at night, you have the heavy downpour. So I believe that, without getting caught up in the confusion that skincare often is, we can focus on three important points. Number one remains cleansing. And I believe that in the summer, where our sweat and oil production is quite high, our pores tend to attract a lot of dirt, oil, which combines together, resulting in breakouts, and overall, most skin conditions tend to get aggravated. So, focusing on gentle cleansing is key, which also means we don't over cleanse, assuming that, the harder we scrub, we take off all our sweat and sebum. The oil, it doesn't work that way. So, gentle cleansing is, I think, number one. And number two, I believe we need to focus on sun protection. SPF always remains important no matter where you are, but particularly so in a city like Chennai, where we have, the UV index being quite high and our skin tones being more susceptible to pigmentation and damage in certain ways. I believe a good sunscreen, mineral sunscreens, and we have a whole host of them, especially tinted sunscreens. If you believe, pigmentation is an issue, they work very well. And finally, I believe that, repairing the skin barrier, right? So oftentimes, our approach towards skin and skin health has to be gentle and consistent, as opposed to it being, periodic and harsh. So making sure that the skin barrier, which is exposed to so much of dirt and pollution, humidity trapping at night, has a chance to regain its strength to face another day. So making sure you have a good skin barrier protective agent, like a good moisturizer. And in this weather, I believe, a water or gel-based moisturizer would be ideal, as opposed to a cream or an occlusive one. So I think focusing on these three steps. So cleanse your skin well, protect it from the sun, and then, give it some love and nourishment with a skin barrier repair cream.
Right, that seems to be, encapsulates what we must do in case we are, the other thing I wanted to ask you is about something that you wrote for us last week on skin pigmentation itself, and how important it is for the for people of the subcontinent, for people with a certain skin tone. Why should care be different, or is the same care possible for all kinds of skin tones?
Yeah, thanks for that question. I believe it's extremely important. In fact, we've just celebrated the International Skin Pigmentation Day as well. So, different skin types have their own set of challenges and their own strengths and weaknesses, so to speak. And in the Indian subcontinent, for most of us with deeper skin tones, pigmentation remains a risk. So this can be any sort of irritation, be it from skin disease, externally, you've applied something, even often skin treatments can result in pigmentation, which is why I believe, a one size fits all approach may not work. A tailored regimen that's again focused on a gentle and consistent approach is vital. And of course, the sheet anchors of treating hyperpigmentation remain SPF and barrier repair. That's something we absolutely cannot ignore. But we have several agents that can specifically target the pigmentation and work in a way that's safe and effective. And I believe we need to again rein in our enthusiasm to get instant lightening and instant glow, and work on consistent results. And our skin does respond to that sort of a tailored, consistent, and personalized approach with a board certified dermatologist.
Right. So this is the month for menstrual hygiene, as it were, and I'm just using that as a peg to turn this topic on to women and their hormonal situations, which also have an impact on skin tone, color, and texture. So can you talk to us a little about this?
Yeah, absolutely. I mean, we often call the skin to be the mirror of our internal health, and most of our conditions, including hormonal, diseases, often show up, on our skin initially, or as a complication, or eventually when the condition is not well managed. So, a major challenge we face now among individuals, again, of our subcontinent is excessive hyperpigmentation around the areas of folds of skin, which includes the neck, the elbows, knuckles, etc. So we find it to correlate with various hormonal conditions like thyroid disease, PCOS, and therefore these conditions cannot be treated in isolation as a skin or a cosmetic issue. Underlying hormonal health has to be considered. Likewise, you have a whole host of hormonal imbalances, ranging from the common ones we see like thyroid to even rare ones like Addison's disease, where we see pigmentation becoming excessive on the skin, acne showing up on the skin. So keeping a close eye for the overall health of the individual and not looking at the skin as an isolated condition can help us identify these challenges ahead in time and do the best for our patients.
Thank you so much, Dr. Monisha, for being with us today. I gained a lot of insights from your little exposition, and I hope our readers will feel the same too. Thank you so much for coming.
Let's wrap up the health trap, shall we?
Yeah, it's about time, but before we do sign off, a fun fact today also.
Sure.
So, vets in Pakistan have apparently discovered a new means of treating elephants with tuberculosis.
Wow.
Yeah, so they are fed 400 pills, I mean the same anti-tubercular drugs that humans have,
Okay.
in a day, and this is to adjust or account for the weight of the food that they take, which is 4,000 kilogram per day.
Wow, 400 pills a day.
Yeah,
That's
400
a lot.
pills a day. Yeah. I'm glad, I'm not an elephant at least.
Yes, sure.
We started with the elephant in the room and then we're completing with elephants. So that's a wrap. Goodbye then for today. Do join us on the next episode of The Health Wrap by The Hindu. Thank you.